Hello everyone, and welcome to Biomedicine Explained, your resource for drugs, medical devices, and other medicine-related topics explained in a language that anyone can understand. My name is Dr. Jake. I have a PhD in cancer biology, and today I'm going to highlight a drug for cancer known as Cabometyx. Now, before we get started, I would like to give y'all some disclaimers. This video is intended to serve as educational material for both patients and general audiences. This video does not serve as a substitute for a medical diagnosis or the prescription of any drugs. I do not represent any pharmaceutical companies, including the manufacturer of Cabometyx, Exelixis Incorporated. I just like talking about drugs and cancer. Always talk to your doctor before you make any major medical decisions. They know your specific medical context and can be trusted to make the right decision. In this highlight, we'll be going through the indicated cancers for this drug, its mechanism of action, adverse events, its interactions with other drugs, and uses in specific populations. I've provided timestamps for each section in the description of this video. To get started, let's first identify the cancer targets for Cabometyx. Those targets are advanced renal cell carcinoma, hepatocellular carcinoma, differentiated thyroid cancer, and neuroendocrine tumors. Now, these are all big medical terms and names, and the specific use of Cabometyx for each of these diseases comes with its own stipulations. So, to provide some context, these stipulations are in place because of the efficacy and safety studies approved by the FDA. However, an individual patient may actually receive alterations to their therapy at the discretion of their doctor. So let's go through each one of these cancer types together. The first cancer we will look at is advanced renal cell carcinoma, more commonly known as kidney cancer. In fact, renal cell carcinoma is the most common form of kidney cancer, and is more specifically the cancer of the cells inside the tubules of the kidney. Tubules are the blood vessels within the kidney, essentially, and it's cancer of the cells that make up the walls of those blood vessels. And to give some more insight into our cancer terms here, when we're saying advanced, we're talking about stage 4 of ARCC. Stage 4 means that the tumor has multiplied into more tumors and begun to spread to other areas of the body. Cabometyx, alongside nivolumab, brand name Opdivo, is the first line of therapy for ARCC, making ARCC the more flagship and advertised indication for Cabometyx. And this is also a good example of the stipulations necessary to receive Cabometyx as a patient. You'll need to progress to the advanced stage of renal cell carcinoma, and will also need to simultaneously receive Opdivo. Exelixis has made a great video animation that illustrates how both Opdivo and Cabometyx work together to combat ARCC, and I put a link to that in the description below the video. Our second indicated cancer is hepatocellular carcinoma or liver cancer. HCC is cancer of cells called hepatocytes, which make up about 70% of your liver. These are the cells that help your liver metabolize food, drugs, and other nutrients. There are no listed stipulations for what stage of HCC you have to reach before taking Cabometyx. The only stipulation is that you need to have already been treated using the drug sorafenib. Next up, we got differentiated thyroid carcinoma. This is cancer of the cells in your thyroid that make hormones. These specific cancer cells do not look different from regular thyroid cells when you look at them under the microscope. There's two major stipulations for receiving Cabometyx for DTC. One, your DTC has reached an advanced or metastatic stage despite VEGFR targeted therapy. And two, you are radioactive iodine refractory or ineligible for radioactive iodine. And our last cancer is pancreatic and extrapancreatic neuroendocrine tumors, or PNET and EPNET for short. Both of these cancers are cancers of the cells that produce hormones like insulin and glucagon. PNET just originates within the pancreas, and EPNET originates on the outside of the pancreas. Now that we know which patients are likely to be prescribed Cabometyx, we can start talking about its mechanism of action. The first thing we want to know is, what is a mechanism of action? A mechanism of action describes how a drug works on a molecular level. This means we're asking, how does a drug physically interact with the cells of our bodies? Here's the direct answer to that question in the prescriber information. In vitro biochemical and or cellular assays have shown that cabozantinib, aka Cabometyx, inhibits the tyrosine kinase activity of MET, VEGFR 1, 2, and 3, AXL, RET, ROS1, TYRO3, MER, KIT, TERK-B, FLAT3, and TIE2. These receptor tyrosine kinases are involved in both normal cellular function and pathologic processes such as oncogenesis, metastasis, tumor angiogenesis, drug resistance, and maintenance of the tumor microenvironment. Now, these are all science words that are intended to be read by scientists and healthcare providers. So we'll translate this together. One way we can understand how this drug works is to look at the diseases it treats. So let's ask ourselves, what do the indicated cancers have most in common? Well, thanks to research, we know that these cancers experience the biological process known as angiogenesis more often. What is angiogenesis? Cancer starts with a single cell. The cell divides and becomes more numerous. However, one important aspect of this growth and multiplication is the formation of blood vessels. That formation is angiogenesis. Blood vessels provide cells with oxygen and nutrients to sustain them and help them grow. Eventually, we get a large tumor full of healthy vascularized cells. Then the cells break off and spread throughout the body. How does Cabometyx work against this problem? Well, angiogenesis happens because there are special proteins called receptors that cells use to communicate with each other and the greater systems of the body. All four of our indicated cancers happen to have more of the receptors that promote blood vessel formation. These receptors are VEGFR, MET, and AXL. Cabometyx attaches to these receptors and prevents them from initiating angiogenesis. Well, then what happens when we prevent angiogenesis? Theoretically, cancer cells will receive less nutrition and the blood vessels won't form or spread throughout the tumor. This would leave cancer cells more vulnerable to the immune system and cell death. Now, all of this is great, but it doesn't necessarily guarantee cell killing. Let's circle back to the mechanism of action description. We talked about these highlighted receptors and angiogenesis, but not the other receptors nor the other processes. Angiogenesis is a unique target for our indicated cancers, but it's not the only one. So let's use what we just learned about receptors to fill in the gaps. A cancer cell has more than one process that needs to go wrong before it becomes cancerous. All of these 3 to 5 lettered and numbered acronyms represent different receptors on the cancer cells, and these are the receptors that trigger those different pro-cancer processes, or that can trigger them. these exact pro-cancer processes are called oncogenesis, metastasis, drug resistance, and tumor microenvironment maintenance. So if you block these receptors, you in turn help prevent these pro-cancer processes from happening. We'll go over each one quickly. When we prevent oncogenesis, we prevent healthy cells from turning into cancer cells. When we prevent metastasis, we prevent the spread of a tumor to other areas of the body. When we prevent drug resistance, we make the tumor more vulnerable to cancer drugs that kill them. And when we prevent tumor microenvironment maintenance, we prevent other cancer cells as well as healthy cells from sustaining and supporting the tumor. One more thing we should all know is that the pro-cancer processes that Cabometyx covers are not all the pro-cancer processes that exist. They are also not all the receptors known to be involved in each of the targeted biological processes that we just talked about. Trying to target every single receptor is not possible for one molecule and would require more than one medicine. That's why treatment plans like Opdivo and Cabometyx, or even different chemotherapies in general, exist. Taking Cabometyx essentially leaves tumors isolated from nutritional support and vulnerable to destruction by immune cells, other drugs, and natural cell death. So those are a lot of biological processes being disrupted at the same time. And because of that, your doctor will most likely be performing routine blood, urine, blood pressure, oral exams, etc. to monitor your safety. And speaking of safety, we can now address the adverse events. These adverse events can have different consequences for your treatment that can span from withholding Cabometyx to stopping its use. Your doctor and pharmacist will have the specific dosing regimens and evaluations to determine the direction your treatment will take. But before we keep going, there are some considerations that we should take when learning about adverse events. First, it's possible to undergo treatment and not experience any adverse events at all. And it's also possible to experience one or more than one. Every individual's medical history and state of disease is different, and everyone will have unique experiences with a drug. Maintaining communication with your doctors and pharmacists and reporting on all side effects you experience is essential to having a smooth treatment. And finally, while this information is taken directly from the medical provider prescription information, it's not fully comprehensive of all the possible adverse events. If we're going to understand these adverse events, we're going to need some context. Cabometyx is an orally administered pill. When you take a pill, its contents are distributed through your whole body from your stomach. Like we talked about in the mechanism of action section, Cabometyx also disrupts healthy cell functions. This means that Cabometyx can affect healthy cells in your body, which is why these adverse events exist. Start with some general side effects. These are called general side effects because they're not conventionally measurable, and we don't really have direct percentages of how many people actively experience them while on Cabometyx. The first of these is the impairment of wound healing. So remember that Cabometyx disrupts blood vessel formation. This would make it so then that wounds don't have the typical support systems that allow them to close quickly. The potential for this adverse event actually makes surgery no longer an option for therapy while you're taking Cabometyx. The second general side effect is a condition known as reversible posterior leukoencephalopathy syndrome, or RPLS. This is a rare brain condition that can give you headaches, seizures, confusion or depression, and may impair your vision. This condition is not something that you can self-diagnose since its symptoms are not necessarily unique. You need to be diagnosed by a medical professional by using an MRI scan or any other similar type of brain scan to detect it. Now we can talk about the adverse events which occur in greater than 20% of patients. Depending on the person, these events can be enough to withhold treatment or even suspend it altogether. The way your treatment changes will depend on your medical history and the severity of the adverse event that you're experiencing. You can expect that adjustments to your dosing regimen will be made while you're taking Cabometyx. The other thing about these events is that they can be indicators of other more severe events that we will cover in the next section. And the percentage ranges that you are going to be seeing next to these events are taken from 3 clinical trials with groups of 300 people or more. Some of these symptoms with only 1% were only measured in 1 clinical trial. We'll start with what I like to call the usual suspects of drug adverse events: diarrhea, nausea, vomiting, and fatigue. Now, I call them that because you have most likely heard them in drug commercials, but the list is much longer than that. As you can see, the adverse events here are things that you can very easily detect yourself. This does make things easier in the sense that you can call your doctor to report them as soon as they happen. I do want to also pay special attention to hypertension. This event can have consequences for your treatment that are heavily dependent on your medical history. I will discuss this more in the next section. The last of these events is called palmar-plantar erythrodysesthesia, or PPE. PPE is commonly called hand-foot syndrome, and it presents as the redness, swelling, or blistering of the hands and feet. You may also feel tingling and numbness. I'm providing medical pictures of this because it's not necessarily something that everyone knows about, but can be a side effect of many other cancer therapies. Now let's move on to significant and fatal adverse events. The first of these is hemorrhaging or bleeding. This specific type of bleeding happens when the walls of a blood vessel lose their integrity and burst. There's blood vessels all over your body, so this can happen anywhere in your body. The most vulnerable area being your brain. Symptoms of a hemorrhage can vary based on the area, but symptoms of a brain hemorrhage are dizziness, shortness of breath, confusion, nausea, vomiting, and increased heart rate. The next type of event is a thromboembolic event or thrombosis. A thrombosis is a clot of blood that blocks your blood vessels. You'll soon see that all these fatal events are associated with your blood vessels. Blood clots can also happen anywhere in your body, so the symptoms vary from our usual suspects to pain, shortness of breath, or visible darkening of your skin. Cabometyx can also cause perforations or fistulas. Perforations are holes in the walls of your organs, connective tissues, or vessels. And fistulas are connections between blood vessels that were not meant to form. In line with the other potentially fatal events, symptoms of perforations or fistulas can vary based on the area they occur in. The best general advice is to pay attention to areas that are in pain or don't necessarily feel or function right. For our last significant event, we can return to hypertension. High blood pressure does not immediately call for suspension of treatment with Cabometyx. The suspension depends on how severe the hypertension is, how well it can be controlled, and how long of a history the patient has with hypertension. Patients with a history of hypertension will more regularly monitor their blood pressure during therapy or may not be prescribed Cabometyx at all. We've now reviewed both the fatal and most common adverse events, but I do want to briefly talk about the adverse events that occur in less than 1% to 20% of patients. I'm not downplaying the seriousness of any of these events, but this video is not meant to be that fully comprehensive. First, osteonecrosis of the jaw can happen. This is the slow degrading of the bones within your jaw, and this presents as blisters or sores, loose teeth, or pus-like discharges in your mouth. While the percentage of patients reported to experience osteonecrosis of the jaw is low, that is more likely because of the adjustments that are made to your treatment as soon as sores appear in your mouth. Monitoring the inside of your mouth is very important while receiving Cabometyx. The next few are hypothyroidism, hepatotoxicity, hypocalcemia, and adrenal insufficiency. We can see that hypocalcemia and hypothyroidism both have the potential to affect more than 20% of patients. These events will not be the most diagnosable or detectable by you outside of the usual suspects we discussed in the last section. The most reliable methods of detection for this are blood tests. Cabometyx can also cause embryo-fetal toxicity, but I'll talk about that a little more in the next section. The last of these events we will review is proteinuria. Proteinuria is the presence of excess protein in your urine. This can be more easily observed as foamy urine, as seen on the left and center images here. To properly close out this adverse events section, we last need to review the interactions Cabometyx has with other drugs. The recorded interactions come with strong and moderate inhibitors and inducers of CYP3A4. The most recognizable inhibitor of CYP3A4 is the grapefruit. This means that patients receiving Cabometyx cannot consume grapefruits or drink grapefruit juice. Now, describing and understanding CYP3A4 and other CYP metabolic enzymes and their functions is not what we're trying to do today. Instead, what we need to know is that drugs that inhibit or induce this specific enzyme are very numerous and are used for many different illnesses or conditions. I've provided a link to the list of strong and moderate CYP3A4 inhibitors, inducers, in the description below. Now, for our last topic today, we're going to talk about specific groups of people who take Cabometyx. We'll look at everyone involved with pregnancy first. For pregnant people, Cabometyx has been found in preclinical research to cause harm to the fetus. In fact, it's estimated that Cabometyx has a 2 to 4% risk of causing birth defects and a 15 to 20% risk of miscarriage. Therefore, it's not recommended that pregnant people take Cabometyx. It's also not recommended that infants be breastfed by patients on Cabometyx. This isn't actually because of research, but because of the lack of research and the potential to harm the baby. For people trying to become pregnant, Cabometyx is also not recommended. Preclinical research found that both male and female rats and rabbits had their fertility impaired while taking the drug. The logic being that if it hurts rats and rabbits, it will also hurt us. Cabometyx is not recommended for children under the age of 12. One note about this is that it's not recommended because there are not any longitudinal studies on Cabometyx. And a longitudinal study is a study that is done over a long period of time. We're talking years to decades. But depending on a child's disease state, their doctor does have the power to prescribe them Cabometyx if they think it's really necessary. It's just that the official drug label and FDA recommendation must be for children to not take it because of the lack of those studies. Our final population is patients with a medical history of hypertension. To reiterate, Cabometyx can increase your blood pressure, so close consultation with your doctor will determine if Cabometyx is right for you. And to close things out with everyone who made it to the end of this video, let's briefly review what we know about Cabometyx. Cabometyx is an orally administered drug that can prevent tumors from forming, spreading, receiving nutrients from the blood, resisting drugs, and sustaining themselves. You should always talk to your doctor about your medical history and experience before taking any drugs or making any major medical decisions. For anyone who is currently taking Cabometyx, I give you my utmost love and support and wish you well on your journey. I've provided links to the animated mechanism of action video, the patient website for Cabometyx, and the list of CYP3A4 inhibitors and inducers in this video's description. Anyone who would like to provide me with feedback about this video format or has any corrections to the information I highlighted in this video, please comment below. Also, please share this video with anyone who may be receiving Cabometyx or is interested in learning about cancer therapy, drugs, or biomedicine in general. And don't forget to like and subscribe if you want to see more content like this. Thanks everyone, and I will talk to y'all later.